Hi friends, welcome back to my channel. Today I am going to discuss part 3 of principles of tooth preparation. Here I am talking about various principles according to contemporary fixed prosthodontics by Restorative. We have discussed various biologic and mechanical principles of tooth preparation. Today I am going to discuss aesthetic principles of tooth preparation. Under aesthetic, minimum display of metal, maximum thickness of porcelain, porcelain occlusal surfaces and subgingival margins. So the aesthetic considerations, it affect the appearance of the patient. Okay. The restorative dentist should develop skill in determining the aesthetic expectations of the patient. And the dentist fully assess the appearance of each patient, noting which areas of the teeth show during speech, smiling and laughing. And the patient's aesthetic expectations must be discussed in relation to the oral hygiene needs and to the potential for development of future disease. And the final decision regarding the appropriate restoration can be made with the full cooperation and informed consent of the patient. So coming to the introduction, most patients prefer their dental restorations to look as natural as possible, and the dentist should aim to fulfill this objective. However, the aesthetic considerations should not be pursued at the expense of the prognosis of patients' long-term oral health or function. In this picture, it shows the healthy teeth which may be disproportionately aligned and so may not display their optimal aesthetic appearance. Here, there are some irregularities in the soft and hard tissues. It has been corrected in the new smile design. And the dark buccal corridors are there. They are corrected using, or these corridors are eliminated by slightly over-contoured porcelain laminate veneers which placed on the premolars. Balance, symmetry and an improved arch form have been successfully achieved. Okay. Here, the advances in dental technology now allow the clinician to improve the patient appearance with minimally invasive techniques. Here, the upper and lower dentitions have been treated with porcelain laminate veneers. Even severely decayed teeth can be restored successfully with porcelain laminate veneers, it improving health, function and aesthetics. Here, this patient showing diastema. So while closing a diastema, the patient and the dentist should review the final outcome before the final veneers are made. Here the composite mock-ups which are simplest and fastest, and in this way the end result can be seen from the first appointment. And the patient gains a full perception including triangular shape of the papilla between the teeth involved. And the final veneers which mimic the contours of the composite mock-up. And through natural integration, teeth look extremely natural. Okay. There are various options for aesthetic restorations which include partial veneer crowns which maintain intact labial or buccal surface in original tooth structure, then metal ceramic restorations which consist of a metal cast substructure that in visible areas has an aesthetic porcelain veneer, and all ceramic restorations. Okay. Some of the most pleasing aesthetic restorations are all ceramic crowns, then inlays, then onlays and veneers. And they can mimic original tooth color better than the other restorative options can. So, all ceramic restorations are of greater risk for brittle fracture than the other restorations. And the newest materials have improved physical properties and can be strengthened through the use of resin-bonded luting agents. In this picture, it shows the ceramic inlays which are an aesthetic replacement for more readily visible amalgam restorations. So these are the visible amalgam restorations and these are the defective amalgam restorations. And here these are replaced by using all ceramic inlays. Here there is 2 all ceramic inlays and this picture shows the teeth which is restored with ceramic inlays. Okay, not in the aesthetic appearance compared to this. Okay. This is the picture showing the adequate porcelain thickness which is essential for preventing direct light reflection from highly pigmented opaque porcelain. This is the opaque layer and this is the porcelain. And the most critical areas are the gingival and incisal third. In practice, opaque modifying stains are used in these areas. Here, this is the critical reflectance and this is the metal frame. Okay, here there is a adequate porcelain thickness is essential for preventing the direct light reflection from highly pigmented opaque porcelain. Okay. Here, this is a picture showing poor preparation design. The treatment plan for these badly damaged incisors was to use the metal ceramic crowns. In this picture, it shows the preparation. Here, the apical margin of the preparation does not follow the free gingival contours. Okay. And the restoration displays the metal collar also. Here, in labially, the metal collar displayed by the restoration. And the deep proximal margins which have led to the periodontal disease. Okay. And this is the correct placement of the mesial margin of a partial coverage restoration. And it is essential for the good aesthetics. Okay, here it is the correct placement of the mesial margin of the partial coverage restoration. To allow proper access of finishing, the restoration must extend just beyond the contact area, but the metal must remain hidden from the casual observer. And in this picture, it shows the tooth. It should be prepared in its long axis, otherwise the metal is displayed. So clearance must be sufficient to permit fabrication of a die system, but should minimize the display of metal. Okay. And this is the picture showing the recommended tooth preparation for maxillary and mandibular metal ceramic restoration. And in each case, the facial reduction has 2 distinct planes. Okay. Facial reduction has 2 distinct planes. Okay. Here, the optimal aesthetics which will require proximal light transmission through the aesthetic veneer. Occluding lingual surfaces are in metal, which extends into the proximal aspect. Here in this picture, it shows the facial margin of a partial cast crown. It should be shaped so that the light is not reflected directly to the observer. And here it is a 3-unit fixed dental prosthesis. Here the mesial abutment is a canine and it's shaped to look like a lateral incisor. And the distal abutment is a partial cast crown which proved to be aesthetically acceptable because the metal had been correctly contoured. Here, a substantial chamfer margin is recommended for the functional cusp of a mandibular partial cast crown and it provides greater bulk of metal in a stressed area. Okay. This is the picture showing aesthetic labial veneers. Here, these are the unaesthetic maxillary incisors with the crowding. Okay, here it is crowding and it is the unaesthetic maxillary incisors. A 50-year-old patient which was not prepared to pursue an orthodontic option. Here the diagnostic waxing to optimal incisor form. Here the vacuum formed matrix is used to place interim restoration resin directly to the unprepared teeth to simulate the definitive aesthetics. Here the tooth preparation done, and there is a restoration in place. So these are the aesthetic labial veneers. This is the picture showing correct incisor gingival height, which is critical in the aesthetic pontic design. Here the aesthetic failure of a 4-unit fixed dental prosthesis, which is replacing the right central and lateral incisors. Okay. The pontics have been shaped to follow the facial contour of the missing teeth. Because of the bone loss, they took too long. Here the replacement FDP. Note that the gingival half of each pontic has been reduced. Okay. And the aesthetic appearance is much improved. Here the aesthetic failure as a result of excessive reduction. The central incisor pontics looks too short. Okay. This is the picture showing the optical illusion. Here the two images which are identical except that one image is upside down. Most of the people which make different three-dimensional interpretations of each photograph, interpreting one as a negative impression and other as a positive cast. Verify the illusion by turning the picture. This is the image when turning the picture upside down. Okay. Here, this interpretation is actually based on how the shadows fall. In normal situations, the objects are seen illuminated from above. Okay, so we can see that these images are same. So, images A and B are identical. Okay. Here, the pontic should be interpreted as a growing out of the gingival tissue. Here, the second premolar pontic in this 4-unit partial FDP, it is successful because it is well adapted to the ridge. However, it is evident that the first premolar, a pontic, because of its poor adaptation of the ridge, here it is the first premolar, and here poor adaptation to the ridge, which creates a shadow. And this shadow around the gingival surface, it spoils the aesthetic illusion. Here, it is the growing out of the gingival tissue. Okay. And here it is successful. It is well adapted to the bridge. And here the poor adaptation to the ridge, which creates a shadow. And this shadow around this gingival surface, it spoils the aesthetic illusion. Okay. Here it is difficult without a surgical augmentation to fabricate an aesthetic fixed prosthesis for a patient with extensive alveolar bone loss. And one approach is to contour the crowns normally and to shape and stain the apical extension to simulate the exposed root surface. Okay. An acceptable appearance may be obtained by incorporating visual perception principles into the pontic design. In the same way that the brain can be confused into misinterpreting the relative sizes of shapes or lines because of an erroneous interpretation of perspective, a pontic of abnormal size may be designed to give the illusion of being a more natural size. Okay. In this picture, it shows the two people, but which are the same size. It is an example of an optical illusion. Here, these lines which looks like curved lines, but these lines are straight. It's verified by tilting the picture or tilted the page. Okay. Here, these are the Kitaka's rotating snake illusion. The rotation of the wheels which occur in relation to the eye movements. And on steady fixation close-up, the effect vanishes. So when we close to the book, then the effect vanishes. And at a fixed point, the effect will vanish. This is the Kitaka's rotating snake illusion. Okay. So coming to the patient and operator positioning, it is which is showing the top surface of the handpiece which held parallel to the occlusal surface. And in this image, the rotary instrument is in correct axial alignment. So correct convergence is established by moving the tapered diamond parallel to itself around the tooth. Here the careful patient positioning can help obtain a direct view during tooth preparation. Often access is better if the mouth is not open maximally because the partial opening allows the cheek to be more easily retracted. Here the access to the buccal surface. And this is the positioning of the patient and right-handed dentist for tooth preparation of the maxillary posterior teeth. Here the maxillary right posterior sextant, buccal or buccal half of the occlusal surface reduction, and the dentist is at 9 to 11 o'clock position in relation to the chair. And the patient turns head to the left to improve the dentist's direct vision. Here the maxillary right posterior sextant, the palatal or palatal half of the occlusal surface reduction, including functional cusp bevel. The dentist is at the 11 o'clock position and the patient turns the head to the right to improve the dentist's direct vision. Here the maxillary left posterior sextant, buccal or buccal half of the occlusal surface reduction. Dentist is at the 9 o'clock position. The patient turns the head to the right to improve the dentist's direct vision. Here the maxillary left posterior sextant, palatal or palatal half of occlusal surface reduction, including functional cusp bevel. The dentist is at the 9 o'clock position and the patient turns head to the left to improve the dentist's direct vision. Here the maxillary left posterior sextant, distal surface reduction. The dentist is at the 9 o'clock position. The dentist's access is improved by having the patient tilt the head, partially close the jaws and move the mandible in a left lateral excursion. So that is about the aesthetic principles of tooth preparation. Thanks for watching. Please do like, share and subscribe my channel for more videos. Stay home, stay safe.